Will please come to order. And I welcome everyone to the first Help Committee meeting of the 119th Congress. It is an honor to lead this committee, which has a rich legislative history. Surprisingly, I am the first physician to have chaired the Senate Health, Education, Labor, and Pensions Committee, but I am particularly pleased about having this opportunity. I acknowledge Senator Sanders, who will be here shortly, who previously chaired this committee. And although we disagreed often, and I have no doubt will continue to, when we worked together and committed to the process, good things happened. And it's my hope. Oh, hey, good. Hey, Bernie, I'm just complimenting you.
Keep going.
It's my hope that we can build upon these previous efforts, finding new ways to collaborate this Congress. I welcome new members, Senators Hawley, Banks, Crapo, Blackburn for the moment, Kim, Blunt, Rochester, and to have a little bit of a pun, also Brooks. We're excited to have you back, and we're excited to have all the other members. Working closely with the Trump administration and with members across the aisle, this committee has a real potential to tackle broad ranges of issues facing our families. One issue where we can find common ground is addressing the high cost of prescription drugs. Last Congress, we passed the PBM Reform Act, reforming malaligned incentives for PBMs and ensuring that 100% of drug discounts are passed to the patient. We also passed legislation to bring lower-cost generic drugs more quickly to market so that Americans can access these drugs at an affordable price. Although these did not pass last Congress, we will continue to advance them this Congress. When it comes to solving the nation's education woes, the committee must look at the severity of declining child literacy and the long-term effects of that. 2/3 of U.S. public school students cannot read proficiently in 4th grade. 40% are essentially non-readers. Now, students who cannot read are less likely to graduate from high school, more likely to be incarcerated. Without a literate workforce, we cannot fill the over 8 million jobs currently open. We cannot adequately staff the military. By the way, a passion of mine related to this is the issue of dyslexia. 1/5 of us in this room are dyslexic. And it nothing to do with your intelligence, just the way that you read. If we don't address it, though, that child's future is impaired, and if we do, that child reaches her or his potential. It is 20% of us. It is something we must address. We will examine this and work with local and state partners to improve literacy nationwide and to address literacy. One other thing. We need to address the rampant anti-Semitism on college campuses, which led to attacks and harassments of Jewish students. This will be a priority in the new Congress. And we must empower and protect the rights of more than 27 million gig workers nationwide. The Biden-Harris administration attempted to erode the flexibility of independent workers, threatening their ability to provide for their families, but that anti-worker agenda is over. We have to find ways to protect gig flexibility while increasing worker access to portable benefits like retirement and health care. That is something which should be an interest of us all. And I hope both sides of the dais will join in this. Lastly, the committee must take a hard look at our retirement system, specifically the failures of the Pension Benefit Guaranty Corporation, or the PBGC. Because of Help Committee Republican oversight over PBGC last Congress, $375 million in taxpayer funds were prevented from being wrongfully paid to union pension funds. As we look at how to make the government function better, reforming PBGC is crucial to ensuring that Americans can depend on their pension and have a secure retirement. Thank you again to all our members, new and old. I look forward to the debates we'll have and hopefully the policy solutions that will be better because of these debates. I now recognize Senator Sanders for his opening statement.
Thank you very much, Mr. Chairman, and I agree with you. I think given the enormously important issues this committee deals with, it's important that we work together and go forward. I'm very proud of what we accomplished in the last session. Among many other things, we were able to get 3 major drug companies to lower the cost of asthma inhalers to $35, and that will mean a whole lot to millions of people suffering with asthma. We also played a role in making sure that insulin, the price of insulin is significantly reduced, and many, many other areas. As you well know, Last year, at the end of the session, we came together on a bipartisan agreement to address the primary health care crisis, something I hope we will continue to pursue in this committee, by expanding community health centers, the National Health Service Corps, and teaching health centers. We agreed on a bipartisan basis to lower the price of prescription drugs by taking on the greed of the pharmacy benefit managers, PBMs, and making low-cost generic drugs more available to the American people. We agreed in that legislation on a bipartisan basis to reauthorize, expand, and strengthen the Support Act, the Older Americans Act, the Pandemic Preparedness Bill, and the Workforce Innovation and Opportunity Act, among many other things. Those are important things that we accomplished. Unfortunately, many of the bills that we had bipartisan agreement on did not make it into the CR. And I would hope, Mr. Chairman, that together, perhaps the first order of business would be for us to make sure that the legislation we reached agreement on last year gets signed into law. I would hope that we can go forward together on that. It is my sincere hope and expectation that to as great a degree as possible, this committee will continue to function in a bipartisan way. Poll after poll shows that Republicans, Democrats, Independents want us to lower the outrageous cost of prescription drugs, period. We should not pay 10 times more than the people of other countries. I think it's PBMs. I think it's the greed of the drug companies. I would hope we address both issues. Poll after poll shows the overwhelming majority of the American people want to make the cost of child care, public colleges, and health care in general more affordable. I think it's time we took on the greed of the insurance companies. Poll after poll shows the overwhelming majority of Americans want to increase the absurdly low $7.25 an hour minimum wage to a living wage. I have heard from senators on both sides of the aisle about the need to address the massive shortage of primary care doctors, nurses, dentists, mental health counselors, and other primary care workers. I don't think there's any debate on that. We had a really good hearing on it. You, Mr. Chairman, brought forth some really good witnesses. There's no disagreement. Let's see if we can do it. Obviously, there are philosophical differences that separate us, but there are a lot of issues, I think, that there's broad agreement on. Let's go forward and address them. Thank you.
Thank you, Senator Sanders. I now move to vote on adoption of the committee rules. All in favor, please say aye. Aye. All opposed, please say nay. The ayes have it. The rules are adopted. The Health Committee shall stand adjourned.